Hello again, my name is Tracy and I'm the nurse taking care of Ellen Jones today. Ellen Davis, I'm sorry. Dr. Jones has ordered her to have 50 milliliters of ceftazoline 1 gram over 30 minutes in a secondary set that she already has one IV running at 500 milliliters of normal saline, and that's going to run about an hour. So we're going to add this in as a secondary. So we want to make sure that we go in and we check the patient's band to make sure we have the right resident, Ellen Davis. She can also verbalize that to me. I'm going to check her birth date, 9/19 of 1963. She has no allergies. She does have a diagnosis of CHF and pneumonia, so we want to make sure we're assessing those lung sounds. So we are going to, first off, put our gloves on after we have done our sanitizing. Once our gloves are on, I've already got my label made for my bag. Again, we want to put their name, their date, what we're giving them. We want to make sure that we know our drop rate, which ours is 16 drops per minute. And we want to make sure that we label this bag. So I'm going to go ahead and hang that up. Okay. The next thing I'm going to do is go ahead and pull out my tubing. Once I have my tubing out, I need to make sure and close my roller clamp. I'm going to go ahead and spike my bag, which let me take it back off and I'm going to turn it over because it's easier when we turn it over. I want to keep it sterile. Turn it back over. Okay. And I'm going to need an alcohol pad because again, this is already infusing. I want to make sure I take my alcohol pad and I clean this. And I'm going to check my medication one more time. It's the right medicine. It is the ceftazoline 1 gram given over 30 minutes. I do need to check the expiration date, which the expiration date is January 1 of 2023. It's clear. There's no issues with that medication. We have it spiked. It's ready to go. I'm going to clean the port. Once I clean the port, I'm going to insert this. So now it's all running together. I want to make sure to get my chamber and squeeze. And again, we want to check our drop rate. Our drop rate needs to be at least 16 drops per minute. Oh, we're going to check it over a minute to make sure we have the correct drop rate. Once we get our drop rate of 16 a minute, I'm going to close that clamp just so it's perfectly dropping like it needs to be. I'm going to grab my hook. I'm going to hook my other one and drop that normal saline lower because I want this bag to go in quicker. Once this bag is hung and everything is opened, again, I'm going to check the site to make sure there's no inflammation, no redness, no swelling. The actual IV site still looks really good. The dressing was changed today. Everything is open and it's running. I'm going to take my gloves off. I'm going to provide myself with hand hygiene after I throw these in the trash. I want to make sure that I don't forget to label my tubing with my initials and today's date. Once that's done, I'm going to do my hand sanitizer one more time. Everything seems to be running well. I'm going to come back in about 15 minutes and check to make sure that it's all infusing the way it's supposed to be and that she's not having any pain and there's no swelling at the IV site. I am going to grab my documentation. Again, my drop rate was 16 drops per minute. I'm going to initial for today's date that it was given on 12/2 of 20 at 5:02 p.m. And again, I'm going to make a nurse's note at the bottom just saying that her ceftazoline was hung with the 0.9 normal saline at 16 drops per minute for 30 minutes. No signs and symptoms of phlebitis or infiltration. Resident tolerated the procedure well. I'm going to sign off on that. And then I will come back and check on my patient in about 15 minutes.